If you're worried that you're developing arthritis in your knee, here's 9 simple signs to tell you that's what it is. The more of these signs that you have, the more likely you have osteoarthritis in your knee. Sign number 1 that you've got arthritis in your knee is the inability to fully bend or to straighten your leg. In a healthy knee, you should be able to touch your heel against your pelvis or come pretty close. But as you start to develop arthritis, this range of motion starts to decrease. And with a healthy knee, you should be able to fully straighten your leg, even lift your heel off the ground slightly. But with an arthritic knee, you can't fully straighten your leg, so you end up with a slight gap underneath there as you try to straighten it. You may even feel that your knee has a slight bend when you stand.
Next, you may notice that your knee looks thicker or more swollen than it used to. This can feel like a bony thickening, or it may feel more like a puffy swelling due to the associated inflammation. Arthritic pain can be under or around your kneecap if your kneecap is affected, but often arthritic pain is a diffuse pain on the inside of your knee. If you press into the dips on each side of your knee, just underneath your kneecaps, and then go straight back from there, it'll often be tended to press in along the joint line there. As the knee degenerates, the cartilage gets worn away, and this can make the knees bow in or bow out. Bowing out is more common.
Knee stiffness is a very common sign, and this stiffness is usually worse first thing in the mornings after you've been sleeping all night, or if you've been inactive for a while, like sitting for hours. And this stiffness normally will improve after you've been moving around and active for several minutes. But when you've been active for a while, especially in the weight-bearing position, the pain tends to increase. The stiffness reduces, but the pain increases with activity. Now, if you then sit down and rest for a while, you'll notice that it usually improves.
Another thing you may notice are grating sounds or the occasional big clunk in your knee. The knee can become a bit unstable, and in some people it can even give way slightly. Now keep in mind that clunking noises and giving way can be a sign of meniscus injury too. But the meniscus often becomes damaged in people with knee arthritis, and that's where a lot of these noises come from.
Now, if you get some of these symptoms, but they come on pretty quickly, it's less likely to be arthritis. But if they develop slowly over years, then that's another sign that arthritis is what you're dealing with.
And yes, studies have linked arthritic pain to weather changes, especially to high humidity and low barometric pressure, meaning cold, wet days tend to make arthritic pain worse. X-rays or MRI are the best way to confirm the diagnosis. And treatment usually involves strengthening, weight loss if you're carrying any extra weight, and possibly medication or gel injections, but not always surgery.
Anyway, there you go. I hope you liked the video. If you did, please consider liking, commenting, or subscribing because it always really helps. Okay? Cheers.